Mental illness is a significant burden to health globally. It is a topic which has long been considered taboo and has been left out of public discussion, causing significant detriment to how it is viewed and how available treatment is for the public. In recent years, public health officials are seeing a significant increase in the burden to the healthcare system and to the lives of people due to mental illness. Mental health affects all populations, with some groups higher than others. Currently, the estimated prevalence of mental illness is 1 in 5 people. Mental illness is also the leading cause of disability in all ages, and in a study by FMPH, females had a higher prevalence of mental illness compared to males by more than 10%. Young adults from 18 to 25 also rated one of the highest percentages, with concern for ages 13 to 17 rising. Yet when it comes to treatment, only 45% receive mental health services, with the young adults being one of the lowest to get it. Often the risk of mental illnesses are suicide ideation. More than 62% of treatment and services for mental health are suicide prevention, and 41% for rehabilitation.
In 2015, Medicaid covered 22% of non-elderly adults with mental illness and 26% of non-elderly adults with serious mental illness. The Medicaid program covers many inpatient and outpatient mental health services, like psychiatric treatment, counseling, supportive housing, and prescription medications. Medicaid's coverage of mental health services is often more comprehensive than private insurance coverage, so it's a good step towards increasing access to mental health services. Since 1965, the federal government has established and enforced minimum standards for mental health services, which the states can expand upon on their own. The federal Medicaid law has been modified many times, and federal service mandates have increased, especially for low-income children. According to federal requirements, Medicaid is administered by states. States have a lot of flexibility in creating their Medicaid programs, and in the end, the combination of Medicaid mandates and options have resulted in the emergence of 51 different Medicaid programs that operate under overarching federal guidelines, but have been shaped by state decisions about who is eligible and what they're eligible to receive for care.
The measures taken up to this point in time are unlikely to help those who are covered under Medicaid to get psychiatric care. When covered by Medicaid, you are shut out of private practice's fee-for-service system, which is when healthcare providers and physicians are reimbursed on the basis of number of services they provide or the procedures they conduct, and must rely on the hospital system for physician services, which can be limited depending on what care you need. Medicaid only offers part of the solution because most private physicians don't accept Medicaid. Homeless people in public shelters for more than 3 months in any calendar year lose supplemental security income, and if you are receiving Medicaid because of SSI, then you will also lose Medicaid.
One way to find out how to find help, regardless of your insurance situation, is through the Substance Abuse and Mental Health Services Administration's helpline at 1-800-662-HELP or on their website. Misconceptions about anxiety and depression include that general anxiety disorder does not cause serious problems, and its treatment through cognitive behavioral therapy does not produce lasting results. Stigma surrounding depression, for example that depression is an indication of weakness, can also be a barrier to seeking care. It is the responsibility of primary care doctors to encourage treatment and the responsibility of public health experts to dispel misconceptions and educate the public on treatment opportunities, especially treatment options available to those without insurance, which can be found through the aforementioned helpline.